Now to some of the week's biggest health news. Dr. Jessica Shepard, Chief Medical Officer at HERS and women's health expert, joins me now. Dr. Shepard, it's always great to see you. Let's start with colorectal cancer rates in young people. They've been rapidly increasing, but researchers are still understanding the reasons why. So earlier this week, a study found a potential link between ultra-processed foods and a risk factor for colorectal cancer in young women. What do we know so far?
Yeah, when we look at ultra processed foods, a lot of times what we see is this creates actually decrease in minerals and deficiencies in nutrients that are necessary in order to sustain the colon is very responsible for the rest of our body's health. And so with the access to foods that are not helping, especially ultra processed foods, and decrease in fiber, we are starting to see that those colon cancer risks are increasing. And the projection for what we do see in colon cancer is actually more than what we would expect, specifically when we have so many utilizations of treatments and therapies that can actually decrease cancer. So this is something that we actually should pay very attention to.
So are there any foods that women, or I mean everyone, should avoid?
Now, it's not so much creating lists of everything that should be taken off versus being put on. It really is looking at the scope of what you are using in combination with the foods that you have. So again, when we look at fiber, fiber should be increased. Already what we look at the fiber intake for average American could be taking in for an individual. And then when we look at red meats, so red meats are not bad. I really want to make that disclaimer, but it really is the quality of red meats that we're having and how much we're actually consuming. And then again, going to vitamins and nutrients, and that's really where we start to see that whole foods and not being processed is really going to increase those risks of having that as well. So there's so many different features of why we look at foods and the integrity of the food, how much it's processed, and then how much we're actually intaking foods that really have not gone through a processing perspective at all.
Yeah. So, Dr. Shepard, I want to turn to some important news for parents. 8 more infants have been hospitalized in the botulism outbreak linked to recalled baby formula. This brings the total number of illnesses to 23 across 13 states. So what should parents know?
What parents should know is that botulism really is caused by a specific bacteria. And when that bacteria is encountered, how it interacts in the gut creates this, what we call botulism. So it can be quite catastrophic and is, as you've said, even to death. So the most important part is if you have had an outbreak close to you to understand that, and also the type of foods that are leading to this. Now, when we look at pediatricians are the best source and resource to actually get those recommendations on how to decrease risk of botulism. And also the other important part is when we look at foods that are prepared is what is the brand and where were those outbreaks from? And then the other part of that is how can I, going back to what we said earlier, how can I prepare more foods that may have been prepared by myself rather than being prepared and being bought in the store? So it doesn't necessarily mean that you have to eliminate and not buy any foods in the store. But again, looking at the process of what can I do to infiltrate and increase what I'm preparing so it's not as processed in the house.
And Dr. Shepard, while we have you, also want to ask about whooping cough cases. They are skyrocketing in Texas right now. The state has reported over 3,500 cases this year. That is quadruple last year's numbers. So how can people protect themselves, especially ahead of the holidays?
This is where we see that vaccines actually do play a part in decreasing what we're seeing as an outbreak in whooping cough. So again, this goes to personal discussions of an individual and what they feel and how they feel about vaccines. But this is where the data shows that vaccines actually do decrease the risk of having specifically whooping cough, because one of the vaccines that kids do get early on in life is to decrease that risk. And whooping cough can be, again, something that an adult can experience, but when it's experienced from a child standpoint, that's where we start to see a significant increase in complications and possibly death. So again, talk to your pediatrician about what vaccines are, why they're safe, and making a decision that's based on knowledge and making the best choice for you and your family.
All right, Dr. Jessica Shepard, quite a few healthcare headlines that we got in there. We appreciate you for being with us.